Medicare open enrollment is officially underway, and while it may seem a little confusing or intimidating, our next guest says it doesn't have to be.
That's right. His name is Dr. Weldon James. He is a primary care provider with Healthcare Partners at DaVita Medical Group. It's great having you, my friend.
Good morning.
Hi, doctor.
So Medicare open enrollment, it's that time of year where everyone's like, oh, here we go again.
Yes.
It can be a little bit confusing. What's the one thing people need to know about Medicare open enrollment?
Well, the one thing you need to know is that it starts on October 15th and it ends on December 7th.
So we're in the midst of it now.
We're in the midst of it now.
Yeah.
And it's not like the general population where it starts on November 1st. And if you've turned 65 or you've already been on Medicare, you're not automatically enrolled. And you really need to choose a plan that's best for you.
Okay. Fantastic.
And there are several options. You've laid out, for one thing, you have to hit the date, okay? So you need to enroll within that time. And then the next question is, what plan is right for you? What are the most common mistakes that you see patients make when they're enrolling?
Yeah. Now, one of the most common mistakes is that you think one size fits all, and it doesn't. Well, probably within the last year, you may have had a new diagnosis. You may have had several new medications. And the plan that you may have is not the same plan as your spouse. So it has to be individualized.
Gotcha. Absolutely.
Right.
I think a lot of people, when they're getting their coverage, you don't want to get more coverage than you might need.
No, you don't.
In the same breath, you definitely don't want to get less coverage than you might need, because that can end up costing you significantly throughout the year.
Absolutely.
Yeah.
And so we're going to have these community events. And you can see them at healthcarepartners.com. And we're going to have some licensed agents that are going to help you navigate through this process.
Okay.
Yeah. Now, another thing is that when you choose a plan, you want to have a healthcare system, a group of providers that provide an integrated plan, like the total care model we have at Healthcare Partners. We have an integrated group of professionals, primary care physicians and specialists and educators that can help you navigate through this process, particularly if you have these complicated chronic conditions like emphysema, congestive heart failure, and what have you.
Something where you might be bouncing from doctor to doctor.
Yes.
You not only want to make sure that every doctor's on the same game plan without having to wait for things to be faxed.
Absolutely.
But it's all on the same computer system with all these Healthcare Partners doctors, which means that cramp in your hands that you get filling out the same forms at every place doesn't have to happen anymore.
Absolutely. You want everybody on the same page.
Worth the cost of admission right there, which, by the way, this is not an extra cost. It's just something you get with Healthcare Partners.
Absolutely.
There we go.
Sean and I have often commented on how many Healthcare Partners buildings we see. I mentioned I passed one on Warm Springs yesterday. I would think because you have so many locations as well, that this helps people just, you know, your healthcare is very accessible. It's near you.
Yes.
Yes? How many locations, how many facilities do you have
Good luck
throughout the
counting.
valley? Or give us an idea.
Even he doesn't know. There's a lot.
Yes, we have, I know we have, the one I work on is on Burnham Avenue.
Okay.
But they're as far out as Henderson. There's one off St. Rose as well. There's one out in Green Valley.
They're throughout Southern Nevada.
They're all over.
Absolutely. Well, one thing, if you're covered by another plan, do you still need Medicare?
You do. And because lots of, in the case if you do not have if you do not have a Medicare, if you're not enrolled in Medicare, they're going to treat any other plan like a secondary plan, be it COBRA or your other health insurance.
If you're still employed, yeah.
Yes. So if you run up a hospital bill, it can be pretty daunting. So you want to make sure you are enrolled in Medicare.
Absolutely.
For that reason.
And so at these events,
I'm sorry, no, if you qualify for it, you want to sign up for
well,
it as
I mean,
well.
it's there, and you've been paying into it all these years.
You are.
Well. Yeah, exactly.
Yeah.
If people they go to these events, you kind of help traverse this whole situation and figure out what's. It's not just, hey, get to the most expensive plan. It's, hey, get to the plan that's right for you. It might be the least expensive plan. Who knows?
You want to get to the plan that's right for you, and so we're going to have licensed agents that are going to help you navigate through all of this, and they're going to interview you. They're going to talk to you individually. And they're going to find out what plan meets your needs.
Excellent.
Excellent.
Doctor, it's a
Thank
pleasure
you so
having you, my
much.
friend.
Thank you. Thank you for having me.
Thank you. All right. Hey, listen, if you want to find out more about Medicare open enrollment, you have until December 7th to make those selections for Medicare open enrollment. Enroll with Medicare.com, a great place to go, or yourhealthcarepartners.com to learn more about your options. Healthcare Partners, a DaVita Medical Group, has locations throughout Southern Nevada, and they're a proud sponsor of the Morning Blend.